And in this first process of sort of making sense of what's going on, people are often putting their lives on hold. So they're just sticking with keeping their job if they can, looking after their sleep, cooking their tea, looking after their family. That's it. They're not planning for the future.
On today's episode, I have a special guest with me all the way from New Zealand. I'm talking with Dr. Bronnie Lennox Thompson, the Program Director for the Department of Pain and Pain Management at the University of Otago, New Zealand. And she's going to tell us through her research as well as her own experience living with fibromyalgia, the characteristics of people who live quite successfully with pain and live fairly normal, happy lives versus those who suffer. I think you're going to get a lot out of today's episode, and if you do, please subscribe to the podcast so you can get notified of our future episodes.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other health experts from St. Louis and around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I have with me here Dr. Bronnie Lennox Thompson from the University of Otago in New Zealand. She's a program director of the Postgraduate program in pain and pain management and also an occupational therapist and lives with fibromyalgia herself. So she's going to share with us some of her experiences, both personally and through her research. And I'm excited to have you here with us today, Bronnie.
Thank you. It's a pleasure to be invited onto the program.
So can you tell me a little bit about how you got into the study of pain?
Yeah, it wasn't because I had fibromyalgia. I started working in vocational rehab where most of the people that I saw had low back pain or frozen shoulder or chronic pain of some sort. And I noticed that that was the main reason that people were having difficulty moving back into their jobs. Our New Zealand market is not the same as the US. Jobs can quickly go if somebody has a pain problem. And so people are often find it really difficult to re-enter the workforce. So that's how I started. And then I realized pain is a really interesting area.
It definitely is. And you mentioned you worked in a department that had a lot of orthopedic surgeons in it. Can you tell about some of the misconceptions that people commonly have about pain, what it is and what it's not?
Yeah, so lots of people, and I'm not just pointing the finger at my orthopedic colleagues, but there's a real misconception that we can find the source of any pain, go in and fix it, and then pain will go. And sadly, that's just not the case. There are some pains that we just don't have effective treatments for. And there are some pains that even if we find the source, we don't know whether what the relationship is between what we can see on a scan and a person's actual experience of pain. So the department I work in does a lot of knee replacement surgery for knee osteoarthritis and hip. And that's our department's main area of research is fabricating new knees for people. They're looking at cell regeneration and very magical things. However, what you can see on an X-ray of somebody's knee doesn't mean that that person necessarily has the degree of pain that their X-ray might show. And lots of people have very little change on X-ray, but extremely painful knees. And that's probably the biggest misconception. I guess the second one that rolls on from that is if somebody has pain and we can't see it on an image, that does not mean this person is just a bit pathetic. It doesn't mean they're malingering. It doesn't mean that they've got a mental health problem. It means they've probably got a very sensitive nervous system that, for lots of reasons, has got itself wound up. And so pain becomes the main problem.
Now, your area of research deals with people who do have pain and live with pain, but live with it quite successfully and cope well. Can you tell me a little bit about what differentiates those who live well from pain versus those who suffer?
Yeah, it's a really interesting question, and I'm still answering it. So most of the time when we think of living with pain, we think this is a terrible thing, people suffer, and we constantly read in research journals and things about people waiting for years to get into services and being horribly depressed and disabled. But I live with a man who has ankylosing spondylitis. Now, that's an inflammatory spinal condition, not just spine, but it's an inflammatory arthritis. And despite living with that and taking lots and lots of analgesia and anti-inflammatories, he is a rural firefighter in his spare time. He likes to climb mountains, carrying a heavy pack. He's constantly active and he works full time. So I was fascinated because at the time that I started looking at this area, I was working in a chronic pain service where every day I heard people talking to me about how hard it was to live with pain. So I was curious, what's the difference? How can some people live really well and be still active, not bothered by their pain? And how can some people just be bothered by the pain? And most of our research focuses on people who are bothered by their pain, who need help for managing their pain, perhaps aren't able to cope with it very well. And we don't know very much about the other group. And there's probably about 30 to 50% of people with ongoing pain actually live really well. And that's pain that's in the, 7 out of 10. Not that I like that pain rating scale at all, but people have got moderate to severe levels of pain, but who are feeling good in themselves. So what I discovered in my study, and I looked at people with a range of diagnoses, both clear-cut ones, like you've got inflammatory arthritis, right through to weird ones like my own fibromyalgia. But hypermobility, Ehlers-Danlos, all sorts of different types of pain problems. And what I found was that it's a process. So we don't wake up magically one day and say, oh, yes, I've got pain. How wonderful. I'll go and live my life. It doesn't work like that. What happens is the first phase is learning to get a name for this thing. So what's it called? What's the diagnosis? And then working out the implications of that diagnosis in terms of what I can and can't do. And that's usually something that people do by themselves. We don't get much help when we're trying to work out, is today going to be a good day? If my pain is like this today, how am I going to be able to cope with my job? Those things are things that people discover by themselves. And in this first process of sort of making sense of what's going on, people are often putting their lives on hold. So they're just sticking with keeping their job if they can, looking after their sleep, cooking their tea, looking after their family. That's it. They're not planning for the future. And then over time, when people have got a name for their problem, they've got some idea about the impact, then they meet somebody, or sometime through that phase, they meet somebody that they can trust. It's usually a health professional, but somebody who doesn't have the answers for them necessarily, but somebody who says, I'm going to stand by you and be your cheerleader while you try things out. And I'll stick with you, even if it looks like things aren't working out. I'll be there for you. And that person, in the presence of somebody's desire to do something that matters, to do the things that matter in their life, I've called it occupational drive in my research, but really it's that desire. I want to be a mum, or I want to work because it's really important to who I am. Or in New Zealand, rugby players. I want to be a rugby player, or, that's who I am. Then those people start to tip over into this sense of, well, if this is the way it is, then I'm going to make the most of what I've got. So the real precursors to this are knowing that the pain isn't going to mean that I'm damaging myself, and knowing that the person, my clinician, is going to stand by me and help me try things out, even if those things don't look conventional. And then once people move into that phase, then they start looking at, well, what are some of the strategies I can use? So most people start to monitor what's happening with their pain, but they don't fixate on it. They're just saying, hey, my pain's at this today, so that means I can do this, this, and this. So they're kind of mindfully aware of what's happening in their body. They're not using it as a hard rule, but they're factoring that level of pain intensity into what they plan to do over a day or a week. They also all do exercise. Now, I'm not an exercise person. So exercise doesn't have to mean you go into a gym, but it can be walking, it can be gardening, it can be going to clear your head for a walk along the beach. It could be playing with the dog. It could be anything that involves whole body movement that gives a person a place for them to think and process and not necessarily have to talk to people. So it's about that ability to put your mind in a different space for a while. So a bit of a meditative approach. And then anything else that helps, that as long as it fits into a person's life. So people will still keep their eyes open for things that might help, but if it's going to interfere with what really matters for this person, they'll just toss it on the scrap heap. They're not going to do it. And then the last sort of part is to live flexibly. So I've called it flexible persistence. So that's about being able to choose to still do what matters, but maybe do it in different ways. So one of the guys that I interviewed, who's given permission for me to share his story, said that he was told when he was quite young that he wasn't allowed to play rugby. He was about 20 and he was told he had osteoarthritis in his knees and he should stop. Now, I saw him at 65. He was on the sidelines for his rugby playing. He was playing Masters rugby because he had injured his shoulder. But prior to that, he started to go back by being a coach and then being a ref, so a referee, and then administering in the rugby club. So he got involved back with the people that he really liked. And then he started to go on to Masters, where you can go in for so long, maybe 10 minutes at a time, and then you say, hey, I've had enough, I'll jump out. So he'd modified the way he went about playing rugby so that he could still do it and still feel like himself. The cool thing about this guy was that he was driving a concrete truck at 65 for very long shifts. He cycled 10 kilometres to where he worked there and on the way back home. So he just kept up his fitness and he still did what mattered in his life. So I think what I've learned from this, for people with pain, is that if we become a little bit more flexible about how we go about doing things, we don't have this rigid rule that I must not have any pain, or we don't have another rigid rule that says, well, I'll just do it the same way that I've always done it. We relax those rules a little bit, then we can find different ways of still doing what matters or moving towards doing what matters, and still feel like who we are. But it's got to be done in the presence of somebody who's a clinician that we trust, who is prepared to stand by us and let us try stuff. And that often means for a clinician, not telling somebody, no, you shouldn't be doing that because you'll harm yourself. So for clinicians, it means standing back a little bit and taking your hands off, but still saying, hey, I'm here for you. And that's a fine line, but it also takes the person with pain being brave enough to say, I'm taking control. This is my life.
So to kind of summarize it, some of the things that you mentioned were having a support system or someone to stand in your corner, to be able to continue to engage in the things that are important, to do some sort of exercise or at least physical activity, and then having an adaptive flexibility to be able to do the things that matter, but maybe not in quite the same way that you used to be able to do them.
Yeah, and I think the other bit that I probably didn't emphasize enough is this mindful awareness. So that's a non-judgmental awareness of what's happening with your pain. So we could call that mindfulness, but mindfulness has a lot of bad press. So it's just noticing without judging what's happening with your body, saying, oh yeah, so I've got an ache in my neck. That's okay. It's just there. Lots of participants talked about it as being just a noise in the system. So like you've got your channel, just your radio channel just off the station and it's all crackly. And so they just put that to one side. And I think that's a really important skill to develop, to just notice without getting stressed or anticipating that this is going to get in the way.
So it's a background noise, but it doesn't interfere with the program, so to speak.
Yeah. You do what matters because it matters, not letting pain be your guide, but letting, what matters to you be your guide instead.
So for someone who might still be in that first stage of just trying to get a grasp on things and figure things all out, get a handle on what's next and what's important and what direction do I want my life to head, what advice would you have for someone at that point in their pain journey?
I think to start with is to try to find somebody who will help you get a name for it. So get a diagnosis or a name for your problem. Now that diagnosis doesn't have to be you have ankylosing spondylitis, but it is important to know that the pain that you have doesn't necessarily mean that you're damaging your body. That's a really important step. Getting a label for your pain helps you to navigate the health system. It helps you find other people who might also have that same label. So, for example, if you've got fibromyalgia and you find another bunch of people who also live with fibromyalgia, then you know that you've found some people who get it, who understand what's going on. And then their experience, especially if they're living well with it, can help you figure out what might help you. And then the next thing is not to try and set yourself big goals. At this point, it is really about just keeping life ticking over, because this diagnostic process is making sense of what goes on is essentially something that we do by ourselves when we're living with pain. We can't at this point think about, I'm going to go and plan the rest of my life out, because we're just thinking about, can I get enough sleep? Am I going to be able to get to my job tomorrow? If I do my job, what state of mind am I going to be in when I get home? So it's just keeping soul and body together, really. And I think that's important, because often when we go to see somebody for our pain, the first thing they want to say is, what do you want to get back to? Well, maybe at that point, the early point, we were just figuring all this stuff out. Maybe we just need to think about things that help us feel secure in our lives. So sleep, rest, having some fun, connecting with other people, keeping our job going. Those seem to be the really important things. And when we've got those sorted, And we've started to get an understanding of the pattern and the how our pain fluctuates, how it responds to what we do. Then we can start looking to, and now what I want to be.
So kind of surviving before thriving.
Yeah, it is. It's funny because we, as health professionals, we often try to push people, you need to go and aim for something more. But that can be exhausting if you're still figuring out what these strange aches and pains mean and whether they could go, or is there a name for it, or am I just making this up? That's a lot of emotional work that we have to do. And it's often forgotten in that consultation as people are really enthusiastic to help you get back to normal. But that's really hard. So giving some people a little bit of time to understand the effect of, say, some exercise practices on your pain or some relaxation techniques on your pain gives you a little moment or two just to work out what your new normal might be. Then you can start thinking about making some big changes.
This has all been really good information. From your own pain journey, what's one piece of advice you would give to someone listening to this podcast today?
Learn as much as you can about pain. Now, that's not very easy to do, but there are lots and lots of websites, and a lot of these websites look at how you can get rid of your pain. And I think understanding that if your pain doesn't go, it doesn't mean that you've failed. It doesn't mean that you're weird. It doesn't mean anything other than you've got a pain problem that doesn't respond to treatment as we know it. So there are two big groups of pain that don't respond very well. Neuropathic pain is one of them, and that's where we know there's damage to a nerve or a part of the nervous system, and we can identify it. And there's lots of different types of neuropathic pain, but it doesn't respond very well to medications, to treatments, surgical treatments, or any kinds of physical treatment. So we need to know that we're not failing. It's not because we haven't tried hard enough. The other type of pain that is really weird and we don't have good treatments for is called nociplastic pain. And this is fibromyalgia, irritable bowel, lots of our pelvic pain problems, things like migraine, the weird types of low back pain that just don't settle. Now, it's not because you're weak or you're not motivated. It's because as a science, we don't understand these pains very well. And the tendency for clinicians and people in pain to feel like they have failed is really high. And I think we need to recognize the limitations. And it's not to say that we won't ever find some way to reduce the pain, but if all we focus on is how can I get this pain down, and we abandon all the things that make life worth living, like good relationships, like having some fun in a day, like going out and seeing what a beautiful world we live in. If we lose all of those because we're looking for the cure, then we've lost the reason for living in the first place. So I would say learn as much as you can about pain. Learn about the fact there's biology, there's some psychology, and there's always a social element to pain, and become comfortable with being your own pain expert.
Well, I know you mentioned there are a lot of resources out there. You have a health skills blog as one of those. Can you share that resource as well as some other resources that may help people to learn more about pain?
Yeah, I think there's some really great blogs. I've been writing healthskills.co.nz since 2007. So there's a lot of material on there. Although most of it's written for clinicians, it's certainly open to other people, people with pain, family members who want to learn a little bit more about pain. Other resources, we have Health Navigator in New Zealand, so healthnavigator.co.nz. The Pain Toolkit by Pete Moore is fantastic, self-management, things that you can do for yourself to have a life. And those would probably be the three biggest resources, but there are many out there. It's just important to make sure that whoever is offering them isn't promising you something that they can't deliver. So it needs to be research-based and not just old studies, but some up-to-date research. It needs to be authentic. So you need to feel like you're talking to a person and you're understanding that it's your job as a person reading it to judge it. Is this going to fit into my life? Does this work for me? And recognize that to do self-management, you need to spend a bit of time to get skilled at these skills. You can't just do one type of exercise and say, oh, it made my pain worse, so I'll just give it up. It's often important to do it for a little while, say a good 6 weeks, and see what it feels like at the end of that time, because there's a learning curve. So, yeah, and find somebody who's going to be your cheerleader as you go through this process, because it can be a lonely and hard road to live with chronic pain.
Well, thank you so much for your time and your information, and I hope you have a great rest of your day.
Thank you. My pleasure.
I hope you got a lot out of today's episode. One thing that Bronnie mentioned is that it does take a support system, that living with chronic pain can be really lonely, especially when no one will listen and no one will believe you. And if you're in the St. Louis area and you need someone to be that support system, to listen and look out for you and help you get pointed in the right direction, I'd be happy to be that person. Just feel free to reach out. You can email me at dave@stlpainexpert.com. Or if you are out of the area, you can also email me and I'd be happy to get you connected with someone in your area. Thanks again for listening and have a great day.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice at 314-941-3970. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.